Edema is inserting liquid or gas into the rectum, which is the lower parts of the large intestine. Edema can be effective in treating certain medical condition, but regular edema can be serious health problem. So this is all my equipments that I ordered to use. First is introduce yourself briefly to the client. Using emergency protocol, explain to the client what we're going to do, why it is necessary, and how the client can participate, and also discuss how the results will be used for their care and treatment. So first is assess for history of bowel disorder. As patient history. So, good day ma'am. May tanong lang po ako ma'am. Meron ka po bang diarrhea or any conditions po for the bowel incisions po? Like yung mahirapan po kayo magpupo ng ilang days po ma'am. Okay po ma'am. So, normal ka naman po. Nagapops di ba po ma'am? Okay po, ma'am. So, next, ma'am, is I want to expect your abdomen's presence of these tensions po, ma'am. So, I go po sa auscultation and percussion po. So, to perform the auscultations, I use my bell of my stethoscope, the right and left lower and upper quadrant of her abdomen. Since the sounds made by internal organs as the heart and lungs. Also listens if they have a bowel sounds. Next is perform percussions, how to determine whether the underlying tissues are filled with air, fluid, or liquid material. So, mag-percuss na ko ma'am ha. Okay po. Percussions, we need to listen if they have a tympani or dullness. Next is review the patient chart for the presence of any conditions that will contraindicate the procedure. Determine the presence of kidney or cardiac disease that contraindicate the use of hypotonic or hypertonic solution. Is note the patient's last bowel movement, recent bowel movement, and then the bowel sound. So for this assessment, and I ask my patients what is her bowel movement. Ma'am, nakalibang ba kaganina or nakapupo, ma'am? So, kamusta yung feeling mo po, ma'am? Okay po, okay naman. Sa bowel movement naman po, ma'am, pila ka magpupo in a week, ma'am? Okay po, ma'am. Daily naman po kayo nagapupo, ma'am, na. So, that's good bowel movement po, ma'am. So, ma'am, makamove ka ba on the left side po, mamaya po, ma'am, kasi pagkatapos po ng this procedure po, ma'am, ipa-left side tama ka, ma'am. Okay lang sa imo, ma'am. Okay po. Next is assess the patient's cognitive level and mobility status. And this procedures po, ma'am, I ask questions of my patient. So, ma'am, when po magpupo ka po, ma'am, nagagamit ka po ba ng CR po, ma'am? So, okay, ma'am. And then also po, ma'am, sa what your exercise daily activities po, ma'am? Okay po, nag-exercise naman po, di ba kayo, ma'am? Okay. Next is check physician's order to patient's care plan to avoid order for procedures to be done. Next is wash your hands properly for infections protocol. Next is assemble all necessary equipments that's needed. Hang and evaluate solutions container about the level of the client chart. No enema, hold or hang the solutions container number higher than 300 cm, 12-inch above the rectum. The rationale of this, the higher than the solutions container is the head above the rectum. For the high edema, hang the solution container about 30 to 49 cm, 12 to 18 inches. Next, identify the patients and explain the procedures to be done to ensure that you are performing the procedures to the right person or patients, and explain the procedure. Kay kaning procedure, ma'am, mag-instill tag solution sa imong lobot para unya makapupo ka. Unya mapa-endoscopy ka man, ma'am. Di man pwede nga naay pupo inside. Di man makakita ang camera kung naay kay blockage, kaya kailangan nato niya procedure. Okay lang nimo, ma'am? So, okay, ma'am. Next is provide privacy of our patients if they have a anxiety. Next is place the rubber sheet to provide solen and the bed linen. So, ma'am, magbutang na ko rubber sheet sa imong kwan, ma'am, ha. Igdaan, ma'am, ha, para dili mabasa aton linen. Next is drop the patients with a bath blanket, allowed for the patient's privacy. So, next, ma'am, is magbutang na kog black blanket po, ma'am. Next is Dan gloves prevents the transmissions of intestinal bacteria. Next is lubricant tip of the rectal tube, about 5 cm, 2 inches of the rectal tube. So, lubrications facilitate insertion through minimize trauma. Next is expose the anal rectal area. Separate the buttocks to locate the rectum. Next is insert the tube smoothly and slowly into the rectum, directing toward the obliquus. So the normal contour of the rectum, insert tube 7 to 10 cm because the anal canal is about 2.5 to 5 cm, 1 to 2 inch long in the adults. Insertions is the point place the tips of the tubes behind the anal sphincter into the rectum. So, ma'am, i-insert ko na po yung tube po, ma'am, ha? So, slowly lang po ang pag-insert ng tube. Administer edema properly. Also, administer the fluid slowly. If the client complains of fullness or pain, load the container or use the lamp to stop the flow for 30 seconds and then restart the flow at a slowly rate. Administrating the edema slowly and stopping the flow momentarily decrease the likelihood of internal spasm and premature injections of the solution. Next is clamp the tube, gently withdraw the rectal tube. The rationale of this, the air instilled into the rectum, although not harmful, cause unnecessary distension. So, ma'am, i-withdraw ko na po yung tube po, ma'am. Dahan-dahan lang po. Okay po, ma'am. So, for the withdrawing the tube, we need to note also if they have the colorations, and also if they have any enema or the colors of the tube. And also, I use tissue to observe if they have any discharge. And also encourage the client to retain fluid as long as possible. So, ma'am, mag-ingana lang ka, ma'am, ha? Tud sa ma-retain ang aton nga solution po, ma'am. So, ma'am, magbantay lang ko diri sa imong gilid, ma'am, kung kanang kalibangon ka na after mga 30 minutes po. After all the solutions has been instilled, or when the client cannot hold anymore and feel the desire to defecate, assist the client to a sitting positions on the bed pad. So, ma'am, magbutang na ko og bed pad sa imong lubot, ma'am. I-assist na lang ti ka, ma'am, para po mag-setting position ka po, ma'am. Makalingkod kag tarong sa bed pad, ma'am. So, okay po, ma'am, ha? So, ma'am, sabihan niyo na lang po ako if naka-defecate na po kayo, ma'am. Dito lang po ako sa labas po, ma'am. Pwede niyo po ako tawagin, ma'am. Thank you po, ma'am. Next is to remove the bed pad. So, ma'am, i-remove ko na po ang bed pad po, ma'am, ha? And also for the removing of the bed pad, measure written if on strict input and output. Next, assist the patients with prenatal care and help patients to assume a comfortable position for hygienic purposes and to provide comfort. So, ma'am, magpunas na ko sa imong lubot, ma'am. Butangan ba nato ning soap, ma'am, or dili na? Okay po, ma'am. Dispose of equipments used to provide transmitting microorganism. Next is remove gloves and wash hand do after care to prevent transmissions of external bacteria. For evaluations documentation, record on the patient charts the type of edema administered, amount of the fluid instilled, and time edema given. Also, record the result and describe patient's response to the procedure. Okay, ma'am, humana ta sa atong procedure na ba kay mga discomfort na feeling ganina, ma'am, sa atong sa atong gibuhat, ma'am, like po sa atong pag akon nga gi-instill po ang solusyon. Okay, ma'am, okay naman po. So, ma'am, okay ra ba ka sa imong position, ma'am, or tarungon ta ka, ma'am? So, okay ra ka sa imong position, ma'am? Comfortable ra man ka, ma'am, 'di ba? Okay po. Okay, ma'am, magkuha lang ko sa imong pass rate, ma'am, ha? Okay po, ma'am. Tapos na po tayo, ma'am. If may kailangan po kayo, ma'am, tawagin nyo lang po ako, ma'am. Nandito lang po ako at babalik na lang din po ako mamaya po. And lastly, observe the colorations of the poops of our patient.